Hey, what's up, Ruggy? See me there? Yeah. I put some stuff together for you. To me, it sounds like kind of a tissue issue. I know you've had a lot of volume lately. A lot of high rep stuff with going through the open here. So my guess is that you had a little bit of tension either in the hip or the knee that led to a little added friction. Whether at the knee joint or it was at the hip, and then that led to the knee itself, and you got to look both up and down the river from the pain itself. But regardless, I'm going to show you. I'll go through some little tricks that I would address that with first, and then you're going to have to cut down on movement patterns such as the squat, things that create that pain. Anytime you're in flexion, we're adding tension to the knee joint, as you know. So in order to fix any sort of inflammatory response, we need to reduce friction. So you're going to have to cut back from the high repetition squat. I don't know if you just did the last open workout, you had a crap load of wall ball squats, and I'm sure that added to kind of the friction issue that you got going on. So to start with, I would grab a lacrosse ball, and I call this gapping only because it creates some gapping in that knee joint itself. But for you, being that you also mentioned there's pain behind the knee or tightness there, work kind of behind the knee, but also lateral. Grab your lacrosse ball, stick it in behind your knee, okay, here. Pull that leg in tight, okay, and you can start just with little circles at the foot, okay. What that's going to take, it's going to take that lateral, basically the lateral aspect of the calf there, where it comes up and over the knee joint, as well as the hamstring, where that crosses the joint. There's just a lot of shit crossing at the knee joint and things get tight. That's just going to kind of start to break up and free up some of those adhesions. You can also grab that leg, bring it behind you, and really drive back into it, release, drive back into it, release. There's Dick. Into it, release, okay? And then really go lateral here, okay? And you can take that leg itself and drive that tissue back into the ball, okay? And I would spend about 5 minutes with the lacrosse ball, and do both legs. I mean, just because you're dealing with issues there doesn't mean that it couldn't, soon be on the other side. You get compensatory movements, and the next thing you know, the other side is bugging you. From there, I want you to then take this is a Supernova. This is a mobility wad ball. Lacrosse ball works for the ITs, but you don't get enough leverage. This ball is bigger. If you don't have one of these, just grab a softball. And if you don't like the seams on the ball, then put it in a wool sock. From here, you're just going to work all the way through that IT band. Now, when you get down to that lateral junction, and this is like where hamstrings, vastus lateralis, everying kind of comes, the IT band, of course, comes and just everything kind of converges here as it crosses and connects at the tibial plateau and in by the knee. So there's just so much going on there. Take that ball, put it right in. You're going to find a little nook. Okay, put it right in there and drive your hand down on top of the leg into that ball and really just smash the hell out of it and break up all that adhesion that might be in there. Really try to relax when you do it. If you're real tight, you're going to be fighting against the tissue itself. Relax, relax, relax. Okay? From there, work all the way up your IT band. You should be able to separate you, or if you got like your wife or one of your training partners, you should be able to separate the IT band from the vastus lateralis. It shouldn't be just one congealed kind of sheath there. You should be able to really get in there and separate and feel the distinction between quad muscles, IT, and then when you get back into your hamstrings. My guess is that stuff is just bound up really tight, okay, and we got to start to break up and free up some movement there. From there, another little trick you can do, grab a bar, fucking hate, but it works really well. You're gonna take a bar up on the side of the leg, other foot on the other side of the bar here like this. My leg is out in front of the bar, not behind it, okay? And you're just gonna take very light pressure and work all through. These are your adductors on the inside. Now, even though there isn't pain in here, if you're really tight, okay, and overactive on the inside, and that's pulling, you know, if that pulls everything in here as we go into squat, then what that's doing is creating extra stress laterally, okay, and especially when we get up top, you know, where that IT band goes, basically where we originate up top here, and that's going to affect all of this quad tissue, the hamstrings, and ultimately this down here is where you're going to get your pain. So take that bar and work real well, especially as you get up into the VMO. It's going to bug the hell out of you. It's going to hurt. Breathe, relax, allow that bar to kind of find its way in there. Then flip on to the front side, work all the way through your quads. Don't go over the kneecap itself, but you can work right down into that patella tendon and VMO. You know, up top here, just kind of change the angle of the leg. You can turn and get a little bit lateral. The only problem is you're going to want to lift your leg up on something, because that tension there driving down on the knee is going to be a little tough inside. But if you drop the leg here, you can kind of get into the IT band. It's not quite as good as using the ball, but with the bar, you really want to work that inner tissue in the adductors. So, rule of thumb, break up, okay, all of the poor tissue quality first before we stretch. Then your last one I want to show you here, work your upper glutes as well. Okay, your TFL and some of your hip flexors, as well as the superior glutes. You know, up in here, TFL crosses over. All of that stuff dictates, you know, what's going on with our IT band. And the IT band, you know, ITB syndrome, if you get really tight up top, that's going to affect down at the knee. There's also more things crossing down here that the IT can affect. So it might not be that the issue is here, it could be up top. So get that same ball into the, you know, superior glutes up high, and then work, if you follow that hip flexor band all the way around, right when it passes under the hip, okay, if you get in that area right there, you'll feel there's a little nook there. I'm sure that's going to be really tender. And then of course you get into your lateral glutes as well, and those again, those dictate that, you know, they're the ones pulling out on the femur and on the hip. So if those babies are too fired up, we're getting a little too much lateral tension, and that affects medial down here, and then this is all messed up because of that. It's, you know, it's one big chain, so we can't just address here. Now, two little stretches. This is an IT specific stretch, and I really like this one. My Pilates instructor way back taught me this. So you're going to go down on your side. You're going to take your lower leg, so you can see me. Lower leg here is going to go, what she always taught me was open up the top leg, okay, clear all of the lateral hip flexors and everything out of the way, bring it back down, okay, then take your lower leg, set it on top of the knee, grab this upper foot, and then drive down on the knee with that lower, would be my right foot. So I'm driving down on the top of the lateral side of the knee, and you're going to feel a very sharp and distinct kind of stretch. And this is what this is we're stretching where the IT band connects to the tibia and the tibial plateau. So I'm driving down on top of that knee. Hold that stretch, hold, relax, go back to extension. Again, open up, around, knee goes on top, grab the foot, drive that knee down, hold. I'll hold about a 20-second count. Good, relax there. So again, work both sides as well, but you're going to feel that one very localized right onto that tibial plateau. Last one is a hip floss. So I'm going to grab grab a mat, put my knee on. You've got to open up your anterior hip, because if you're too tight and you're in kind of an anteriorly rotated position, okay, that where our IT band comes up and connects up top here, that's going to put a lot of extra tension, okay, which then, of course, the guy that gets the brunt of the stress is down here at the knee. So I'm going to take that band. You might already know what these are, but foot goes through the band. I bring the band up, and I would use a big one. This is 1.5 inches, right up underneath your butt. Hold my rack with me there. You're going to lean back, put the weight in the knee, and then drop your hip forward. That band is pulling traction against my femur and giving me a little extra stretch. Okay, relax, drive it back down again. So this is called hip flossing. This is a Kelly Starrett little move. We use it quite a lot to open up the front of the hip. So you're gonna have to kind of test these things out yourself and see, you know, if you get any sort of relief over the next like 5 days. The one other thing I would do is address that you have good mobility in your ankles. If you lack dorsiflexion, you know, that's where driving the knee forward. Okay, if you can't drive that knee down without the heel coming up, then probably your knees are taking a lot more stress in the squatting movement than they should be. So start to open up some mobility in the ankle, little what I call knee drivers. So you're just going to drop the knee down, come back up, drop that knee down, and sit back, kind of in the front. I drive that knee in and out, okay, and all that I'm doing is trying to open up some extra dorsiflexion at that ankle, and then also just go into a nice calf stretch where you come up tall, and then rock that knee in and out in that calf stretch itself. Okay, we're just trying to open up and release tension around that knee joint. All right, let me know how these things work out for you.